I'm Losman. I am one of 14 people who put together this workshop. We're really happy to have you here. We have a fairly small audience in that we have more of us than of you, which means that we're going to try to be as flexible as possible with regards to the agenda. We have 4 mini lectures, 15 minutes each, covering a broad range of topics, and then we have breakouts. And the idea is that you, as the audience, will go to each breakout that makes sense to you. Truthfully, if there's a question that you have on that topic, for example, program implementation, and we don't have a breakout that answers your question, pose it. Walk around to the tables, pose it to various people. We have a wealth of expertise from across the country, and there is someone here who's going to be able to engage you, give you ideas, give you feedback, etc. So without further ado, this is the workshop on harm reduction with a compassionate and evidence-based approach to the ED management of substance use disorder. This is not my computer, so let me just make sure that I'm doing this correctly. So this is our team. Carrie Mitchell is sick, so he's not here. Aaron and Joffer are our education core. And for those of you who are educators who are looking to create curricula around harm reduction, please make sure to find them. They have some really good content. Corey is unfortunately sick as well, but Kaylin, Karen, and Lauren are going to be focusing on program implementation, and then they'll be part of the breakouts around the room. Bill is going to be kind of a pluripotent stem cell like most EM physicians and kind of going around to various aspects, but focusing on a lot of the more complicated and advanced topics in SUD. Liz is our legal expert, our policy expert, and she's going to be talking about that shortly. I don't know if Amy is here yet, but she too will be kind of joining various groups. And then Brad and Nate are both EM physicians who are trained addiction medicine specialists, and they're going to be talking a lot about the bridge between the ED and the community for patients with SUD and with kind of complicated issues related to SUD. So of course we can't start a talk on harm reduction without talking about the numbers. You guys, I'm assuming, are all very familiar with these statistics, but since 2014, poisonings, most of them overdoses, have overtaken motor vehicle accidents with regards to preventable deaths. And this is why we're doing this workshop. This is why a lot of us devote a lot of our time to this topic. All of us have seen these slides. Synthetic opioids are a huge problem right now, and the deaths are climbing. So what are we doing in EM? We're thinking critically about harm reduction. So we're talking about screening of patients for SUD. We're talking about take-home naloxone, medication for opiate use disorder, and medication for alcohol use disorder. So without further ado, I am going to ask Lauren, Kaylin, and Catherine to come to the podium and talk a little bit about program implementation.